Good morning, everybody. Thank you so much for your patience while we work through a few issues there on the back end. My name is Haley Bell. I'm the training program manager for Telehealth Rocks, and I'll be hosting today's session. Telehealth Rocks is a federally funded program designed to support behavioral health in schools. We focus on addressing social determinants of health, supporting school-based services, and offering trainings like the one today. Next slide, please, Lenny. And one more. We do have just a few notes before we get started. The session is being recorded, so we will send that to you afterwards. Your microphone also has been muted, so please use the chat to ask any questions you have throughout the session. We do have some time at the end for those. And please make sure your first and last name are visible on your Zoom screen just so that we can use that for attendance and certificates afterwards. As for disclosures, we have no disclosures for today's session, and everything presented today is evidence-based. And then for after the session, all of the links and resources shared today, along with the slides and the recording, will be sent out in a follow-up email once that's processed. Same for the certificates of attendance. So for the entire series, that will go out once those are created as well. And then as always, please feel free to send any questions you have to our Telehealth Rocks inbox, and we'll put that in the chat for you. And then for our presenter today, we are so excited to have Leni Swails joining us again. Leni is a clinical child psychologist and has led our ECHO series in this final session today. So I'll go ahead and pass it over to you, Leni.
Thanks, Haley. Well, it's great to be here with everyone this morning. I'm looking forward to talking with you guys about ADHD and disruptive behaviors today. When we had done our survey in our first session, you guys were like, yes, please talk with us about ADHD. So I'm delighted to be able to deliver on that. We're going to be talking today about some kind of basic facts like prevalence rates and co-occurring conditions that go along with ADHD. We'll also be talking about what is kind of best practice and evidence-based treatment for ADHD. And then we'll be also discussing some strategies that can be helpful for working with students who have ADHD. And then we'll wrap it up with a case that one of you guys has generously offered to share with us. So I'm looking forward to this discussion. So starting off with some basic facts and figures about ADHD. As you guys know, it's one of the most common diagnoses among kids related to mental health and development. So that's probably why everyone was like, yes, talk with me about ADHD, because I know all of you have students who have these diagnoses. Depending on the stats that you look at, it affects up to 5% of children. It's more common in boys compared to girls. What's really interesting is that if you track over the course of the lifespan, the ratio of male to female diagnosis is biggest, like more boys are diagnosed compared to girls. So there's the biggest gap between gender and diagnosis in childhood. And that gap starts to shrink in as you get closer to adulthood. So in childhood, it's a 2-to-1 ratio where for every two boys diagnosed with ADHD, there's one girl diagnosed. And then once you get to adulthood, it's 1.6 to 1. So what this tells us is that girls, when they are diagnosed with ADHD, it tends to be later. And I feel like there's been a lot more conversation in the last 10 years about how girls and women tend to be missed and their ADHD diagnosis isn't recognized until they're getting closer to adulthood. Um, I think one of the reasons why it tends to be missed is that girls more often are having more of the inattentive subtype of ADHD, which might be less visible in the school setting or might be less visible to other people. I think it's also interesting, like as there's been more professional conversation about this male to female gap or like delayed diagnosis for girls and women, I've been hearing this a lot from families too. So families are becoming really well educated about this. And I've seen a lot of parents who are really strong advocates for their daughters, recognizing that this can take a little bit longer to recognize in girls. Um, so some more information about ADHD. There's actually three different subtypes of ADHD. Um, Hyperactive impulsive subtype is when someone has more symptoms of being very energetic, restless, fidgety, constantly moving. In kids, you might often see them climbing on things or having difficulty remaining in their seat when they're expected to be seated. They might be more impulsive, might have difficulty with waiting their turn, or waiting in lines. And so again, it's kind of that constant movement, difficulty waiting is sort of the class of characteristics that you see. The next subtype of ADHD is ADHD inattentive subtype. Sometimes people will also refer to this as ADD or attention deficit disorder, but technically the term is ADHD, predominantly inattentive subtype. Those inattentive characteristics of ADHD is someone who has a hard time paying attention, has difficulty with listening to instructions and following through on all the steps. It might also be someone who struggles with organization, loses things or forgets things often, makes careless mistakes. And then one of my favorite in all of the DSM, which is the manual we use for diagnosing, my favorite phrase is avoids or dislikes sustained mental effort. So individuals who have ADHD are more likely to, quote, avoid or dislike sustained mental effort. So what does that mean in school? It's your kid who, when they see a full page of math problems they have to do, they're like, oh man, that's going to require a lot of sustained mental effort for me. And that's really hard. And then you see some of that work refusal behavior. Um, these are all kind of part of that inattentive subtype of ADHD. So distracted, daydreaming, hard time listening and following through, losing things, disorganized, and then avoiding or disliking sustained mental effort. What I think is really interesting is the most common type of ADHD is the combined subtype, which is where you have both those hyperactive impulsive symptoms as well as those inattentive and distracted symptoms all together. And that's actually the most common type for kids. Um, when we think about assessment for ADHD, the best practice for this involves seeing symptoms and characteristics across multiple settings. And what that looks like on a practical level is that um, healthcare and mental health professionals will have parents fill out a standardized questionnaire that rates these characteristics for their child. And then also we would want to see from a school setting whether it's a parent there too. So usually we're sending questionnaires from teachers and schools to get your input. Um, uh, and most of the time, that's kind of what we're looking at to see, okay, are we seeing these characteristics or symptoms both at home and at school? Are we seeing them in multiple settings? Occasionally, we'll also have another setting we'll rely on. So, like, are they seeing it really obviously in the clinical setting, or for kids who are homeschooled, are we seeing it during their homeschooling activity or day? Um, Another thing to recognize is there's a really strong genetic component to ADHD. Um, kids who have a diagnosis of ADHD are a lot more likely to have parents who have a diagnosis of ADHD, which I also think is really relevant because if you're thinking about working with these parents, it's important to recognize they might be struggling with similar characteristics that their child is struggling with. So when we're asking them to get their school to fill out these forms, they may have trouble with losing those forms or keeping track of them, right? Because they might be having some of those same characteristics. Positively, the way I often frame this for parents is they also have a lot of empathy and understanding for what their child is going through. So if you have a parent with ADHD, I think some parents feel a lot of guilt for that because they wonder, like, oh gosh, is this my fault? My child is experiencing these things. But I think it's really helpful to frame this as a strength that they know how to be the best advocate for their kid because they have a lot of personal experience with that. And they might be able to empathize with them in a different way than other people can. Um, I also think it's really helpful to talk about diagnostic disparities when you're discussing ADHD. We know that African American and Latino children are less likely to be diagnosed with ADHD compared to other racial and ethnic groups. And African American children are a lot more likely to be diagnosed with a behavioral or conduct disorder compared to ADHD. Um, I think this is really important because we know if a diagnosis is ADHD, we might have some really specific medications that could help with that. And if instead we're recognizing it as a conduct disorder or behavioral diagnosis, we might not be using the full battery, like the full kind of arsenal of treatment approaches. Um, and then similarly, there's some information about SES. So Medicaid families are 5 times more likely to have a diagnosis related to behavior or conduct disorder, and might be less likely to have an ADHD diagnosis. I remember when I was in graduate school, we would talk about if you see ADHD, look for the comorbidity or look for the co-occurring condition, because so many of these individuals don't just have a diagnosis of ADHD, but often they have other related areas that they need support with as well. So, 25 to 50% of kids with ADHD will have a co-occurring behavioral diagnosis, like related to motion regulation or mood or oppositional behavior. There's also really high rates of learning disability. Depending on the study you look at, those prevalence rates can range anywhere from 10 to 90%. So I think we're still figuring out as a field how to better assess this, but recognize that a lot of kids with ADHD also have a co-occurring learning disability. The most common co-occurring learning disability is a writing disorder, followed by reading. You can also see a lot of co-occurring mood, like depression or anxiety disorders. And then once you're talking about teens and adults, you have higher rates of substance use disorders, and then also higher rates of accidents and injuries, as well as car accidents. Um, and those accidents and injuries you can see in young kids as well. I've seen a lot of young kids who, prior to having an ADHD diagnosis and getting treatment for that, had some pretty serious accidents that were related to them running off from parents or not paying attention or things like that. And then finally, there's an extremely high rate of sleep problems in this population. And then what's really stressful and frustrating is as the sleep problems get worse, the ADHD problems get worse. And so it's sort of a chicken and egg thing where like those sleep problems can exacerbate the ADHD symptoms. And also having ADHD puts you at risk for sleep problems. So we often want to make sure we're working with our medical colleagues on addressing sleep. Thinking about ADHD in the school setting, and especially related to behavior, kids with ADHD, especially the hyperactive, impulsive ones, they have a high rate of all behaviors. They're sort of like constantly moving, constantly doing things, constantly talking. And what can be challenging is because they're doing so many things, we start to only have the capacity to focus on the disruptive behaviors. And as a result, sometimes kids are often hearing from adults rather than, oh, that was such a great creative idea, or that was so generous of you to share with your friend because they're doing so many negative things as well, our attention gets focused on that. And so they might be hearing these messages of, quit it, stop talking, no running, don't do that. And adults kind of feel like they're constantly chasing after them, having to address these challenging behaviors. When that's the message that they're hearing repeatedly, that can lead to things like poor self-esteem and negative self-image. And then they might also say, hey, that's the way I get adult response and attention. I'm going to do more of that because that's how I can kind of get a rise out of people. So, one of the things that I think is a really important kind of basis for our interventions for kids with ADHD is we need to be really consistent in responding to their positive behaviors. It's really easy to get distracted by those challenging behaviors because they're happening so much, but we need to give extra attention and focus to the positive things that they are doing. And our goal is if we have a target behavior, like sitting quietly and working, instead of being like, oh man, finally I can relax and focus on other things, we need to flip that and instead give more attention to those times that they're doing the right thing so that we hopefully see that increase over time. So the benefit is they're going to get more attention, for that positive behavior. The other benefit is that we know that kids with ADHD, they get distracted and they forget what they're supposed to be doing often. So, for example, if the target behavior is sitting quietly and working, if we notice every time they're doing it and we walk by them and say, great job working quietly, that might also, in a really positive way, remind them, oh, yeah, that's the thing I'm supposed to be doing, sitting quietly and working. So it both gives them reinforcement and it reminds them, oh, yeah, that's what I'm supposed to be doing right now. If you look at what the CDC and the American Academy of Pediatrics recommends as the best practice approach for ADHD treatment, it's a three-pronged approach. The first is school-based supports and accommodations, which we're going to talk more about. In addition to behavioral family therapy, to work with parents and caregivers on ways that we can structure the household to be most conducive to success for a child with ADHD. And then also medication is the third prong in that approach. Um, for young children, like under the age of 6, the recommendation is to try to start those behavioral interventions at school and at home before addressing medication. And then for over age 6, we are probably starting those things all together. The caveat to that is for young kids, if we have a safety concern, like I was mentioning before, a kid who's running off in parking lots, not paying attention to safety at home or in the community, that might be a time that medication needs to be started more quickly so that we can help them stay safe. Now, the challenge is what do kids in Kansas actually get? The majority of kids get medication alone, and then there's a smaller percentage of kids that get behavioral therapy. One of the most effective strategies that schools can do is partnering with home on using a home to school note. And it sounds like a really simple thing, but there is decades and decades and decades of research showing that this particular strategy is one of the most effective ways that schools can support kids with ADHD. The idea of the home to school note is trying to identify really short, like a couple of concrete behaviors that we're working on, and then providing daily updates on how the kiddo did on that. So there's an example on the right-hand side with completes assignments, and then we've kind of got yes, yes, it happened or no, it didn't for each of their subjects. And then the idea is that that way the home is getting frequent communication, not just on the days that it didn't go well, but also on the days that it did. And then we can hopefully start to incorporate some easy, meaningful, and inexpensive rewards. Um, Home rewards, for both rewards, I usually like to I prefer things that are activity-based rewards or relationship-based rewards as opposed to tangible stuff. Um, some kids love to go shopping in the treasure chest, but the challenge is that that starts to lose its appeal over time. And also for families, if we're choosing really expensive things like we get to go to Sky Zone, then we can't necessarily keep that up consistently. And what's most important is giving these rewards consistently, not that we can have something that's really exciting that only can happen occasionally. So it might be 15 minutes of electronic time, renting a favorite movie, taking a trip to your favorite park over the weekend, the special park that you have to drive to as opposed to the one right by your house, choosing what the family eats for dinner one night, or having like a 15-minute later bedtime. Those are things you can actually get kids pretty excited about, and you can do them on a regular basis. At school, some rewards might be things like being able to have a special job, taking a break in the sensory room. Um, Caring for a class pet. I when I worked at school, there was a kiddo who just loved to play basketball with the janitor, and so that would be a special reward that they got to earn. And then the other thing is if there's things that you're trying out and working at school, make sure you let the parents know what that is, and encourage them to replicate it at home. So if you're using visual schedules or you're praising a specific behavior at school, then make sure the parents know what that is and encourage them to say, hey, if you guys can replicate this at home, we know that kids with ADHD do best with a lot of consistency. So we'd love for you to be able to support that too. Some other school supports, especially when you're talking about older kids, we need to think about executive function and organizational support. So things, even something simple like a homework folder can really do wonders for helping teach a kid these are organizational strategies to keep track of your materials. Visual schedules can be helpful for kids kind of staying on track and knowing what to expect. Um, and again, we talked about rewards. For a lot of kids with ADHD, they do best by having a combination of verbal praise, and then also having some sort of reward they're working for. Some kids with ADHD really struggle with transitions, either because they just bolt to the next thing, or what's really interesting is some kids with ADHD will also hyperfixate or hyperfocus on a particular activity that they get really engrossed in. Sometimes having timers can help with transitions for those kids. For kids who need movement, movement breaks or wiggle seats can be great. And then for those kids who struggle with avoiding or disliking sustained mental effort, we might also think about reducing the number of times they need to repeat a concept. So if you have, example, a math worksheet and we're working on just multiplication tables, it might be that for a kid who really struggles with sustained mental effort, we might start with having them just do five of the problems and cover up the rest of the page. And if they can demonstrate success with a smaller number of items, that might be what they need is doing less repetition. Especially if you're seeing work refusal behaviors. And then maybe over time, we start to move from five. Now we're going to do 10 problems. Okay, we've been successful with 10. We're going to start doing 15 and kind of upping the ante over time. Um, Another thing I want to quickly call out is ADHD is actually considered a neurodevelopmental disorder because we know there's a lot of differences in brain structure for individuals who have an ADHD diagnosis. Some of the areas that you see those brain structure differences is in the prefrontal cortex, which is this front part of your brain that's responsible for planning, organization, and impulse control. Um, so I think a lot of times about kind of the prefrontal cortex being sort of the thing that helps you stop and think before reacting. And so the stop and think isn't working as well in kids who have ADHD. Another part of the brain that we know is impacted is the amygdala, which is the part of your brain that's responsible for your emotional response. So if you kind of put those things together, we don't have as much of those mental breaks, the stop and think, and we have a stronger emotional response. You can see why kids with ADHD might have difficulties with emotion regulation because they kind of have that initial strong emotion and then they can't stop themselves from reacting. Um, so there's some different ways we can support kids with ADHD and their emotional reaction. One of my favorite strategies is trying to use what I call preventative praise. So if we know there's a situation where the child often is going to have a strong negative emotional reaction, for example, losing in a game, then we might have an adult stay nearby while they're playing a game and go ahead and preventatively praise the child and say, wow, kiddo, you're doing so great taking turns. I can see that you're staying calm when other people are winning. That's being such a good team player. So having a chance to give them that positive reinforcement before they have a chance to get worked up and have that negative emotional reaction that we all then have to respond to. I know we've already talked in our previous sessions about coping skills like taking deep breaths, but sometimes for kids with ADHD, they struggle with remembering to do that in the moment. So another thing that can be helpful is teaching them that strategy, like taking deep breaths at times where they're calm, so that way they know the skill and they have it under their belt. And then I'll like to incorporate reward systems with using that skill. So maybe every day that they either don't have an outburst or they use a coping skill when prompted, then they might earn a point on their reward plan. So that might be a way to kind of help them be more motivated to use that coping skill in those challenging moments. And then also visual strategies like the 5-point scale that we had talked about in our autism session can be another great way to concretely remind kids about, okay, here are the characteristics that I notice in myself when my emotions are starting to get big. This is what my body does. And then here are ways that I know that I can calm down and respond. And having those kind of concretely laid out in a visual way can be helpful for kids with ADHD. Um, Kids with ADHD, as we talked about, can really struggle with disruptive behaviors. And in our very first session, we talked together about how kind of a grounding strategy that works well for a lot of kids is first building in a positive connection and positive relationship with the adults in their life. And we want to make sure that if you are the one who might be needing to have a kid do specific work for you or behave in a certain way, we want to make sure we first proactively put enough coins in our relationship bank. We want to make sure that we've spent time praising them, engaging in one-on-one activities with them, talking with them about their interests and their games or things they're interested in right now. And then also making sure we're already doing things like noticing everything they're doing right and praising it. Those are all things that add coins into your relationship bank. And that way, when we do have to make those withdrawals and say, like, okay, it's time to sit quietly and work. Please work on this math sheet. Please come to the resource room to work on your reading. All of those withdrawals, we need to make sure we have adequate coins in there first. Again, kind of harkening back to our first session where we talked about considering the function of different behaviors. We talked about how for each challenging behavior we observe, it can be helpful to think about what's the underlying function or what's causing this to occur. Why is this working well for the child currently? And we talked about how there can be a sensory function to a behavior, escape, attention, or trying to get something tangible. And that's applicable to ADHD as well. So, oh, sorry, I forgot I have some animations here. Okay. Um, so using that kind of function based approach, we can also think about that for like a really common ADHD challenging behavior like work refusal. So and I'd love to hear from people in the chat, what might be some examples of reasons why a child might engage in work refusal. So, what would be an example of a reason on a sensory basis why a child might engage in work refusal? Or what would be a reason of how attention is related to work refusal? Or escape or avoidance? Or what would be something tangible a child might be seeking that they're getting out of a work refusal behavior? See, I'm looking and seeing some responses here. So it looks like one response is they might be seeking control. Um, Like they want to be kind of in control of the task or the situation. I think so. I think, thinking about attention, sometimes kids end up getting more attention for the work refusal compared to doing the work. Or sometimes also we'll do things like if a kid's not doing their work, we'll send them to the principal's office, where they might have a lot of time one-on-one with the staff there that they really enjoy. So they could end up getting positive attention that way. I think sometimes they also hope that if they don't do this work, they can avoid this task that's really difficult or overwhelming to them. Um, and then sometimes too, if they don't do their work, they might be able to go and do something else. Like they might be able to go read in the corner or go to the sensory break room where they're getting something tangible they really enjoy instead. So what are and I didn't really have as many ideas in the sensory level about how that might relate to work refusal. So thinking about those positive functions of the work refusal behavior, some ways we could address that is if attention is the function, we want to make sure we're giving them more attention for completing work, even if it's something like picking up their pencil. Good job picking up your pencil and starting to look at that. Or I can see you're looking at problem number three. Great job working on that. So giving them lots of attention for anything that's approaching work completion. And then maybe after they do it, then they get to go and have that visit with the preferred adults they like. Avoidance, like we talked about before, we could reduce the number of items to complete. And we can try to get a little momentum with having them start even first with easier problems that feels less overwhelming, and then adding the more difficult ones once they're on a roll. And then tangible, so instead of them being able to take a break in the sensory room when they're not doing their work, instead we might flip that and say like, okay, after you do three problems, then you get to go and take your break in the sensory room. So instead of them being able to get the tangible by not doing the work, instead we're flipping it so that they do it in order to get that activity. Jenna has some great comments about sensory, doing maybe getting to listen to music while completing the task. That's a great idea, Jenna. I hadn't really thought about it that way, but that's a great idea of having a sensory related intervention. And then finally, I want to say too, I think for ADHD, we're talking about these behaviors, and I know that a lot of times it's easier said than done. And a lot of times when we're thinking about kind of ADHD behaviors, the severity of what that looks like in your classroom can be pretty intense, especially if you're dealing with multiple children who have ADHD, and especially if you're dealing with other layers on top of that, like co-occurring mood disorders or co-occurring learning disabilities or things like that. And I also want to validate you guys. You are right. This stuff is getting harder. As we talked about in our first session, we are seeing like an increase in the challenging behaviors and disruptive behaviors and the severity and the acuity of these problems in the community and at school. And I'm seeing that in the clinical setting too. But I just want to remind you guys and kind of center you on when we're seeing these kind of big behaviors or overwhelming expression of ADHD symptoms, that doesn't mean we need to kind of throw everything out and figure out how to start from scratch. A lot of times, what that really involves is us thinking about what do we already know works for this population. And you guys are great behavioral interventionists who have done this for lots and lots of kids. You know that things like visual supports, positive attention, rewards, and all these other kind of accommodations related to sensory needs. You know that stuff works. And so when we have a kid who's showing these really big, overwhelming behaviors, what we need to do is go back to what we know works and figure out how do we do this with more consistency or more frequency. It's not necessarily that we need a totally new set of intervention strategies. So I want to validate for you in a lot of ways that you know what works. And I want you to feel secure knowing, okay, all I have to do is go back to the strategies that I already know. I also wanted to share with you guys some resources, and we'll be sending these out after today's session as well. These are some of my favorite parent resources related to ADHD and disruptive behaviors. Russell Barkley is like one of the most well-known authors and researchers related to ADHD, and he's got two great parenting books here. One called Taking Charge of ADHD, which has a lot of information about school. It has a lot of great information about executive function and organization, and then also some strategies related to behavior management too. Another book he wrote that I really love is called Your Defiant Child. I hate the title, but I love the book and the content. And it talks about that co-occurrence of disruptive behaviors plus ADHD and how those things can go hand in hand for kids. And it lays out the strategies that I would use as a therapist if I was doing behavioral family therapy for a kid with co-occurring ADHD and disruptive behaviors. So oftentimes I'll encourage parents to go ahead and buy a copy of the book and start looking at those strategies. And then as they're working with a therapist, they can even bring it to their therapy sessions and say, hey, these are what we're working on at home. Can you help us with implementing this? The other thing that I give every family that I make a new diagnosis of ADHD is the CDC has some fabulous resources about that three-prong approach I mentioned, the school plus medication plus behavioral therapy. And it has some great handouts too that describe what that therapy should look like, what's involved in evidence-based therapy for ADHD. And then the CDC also has a great webpage with some strategies to use in the school setting as well. And then also Russell Barkley again wrote another great book about managing ADHD in the school setting. So that could also be some helpful resources for you guys. So, just a couple of key takeaways from our time together today. I just really want to emphasize when we're thinking about effective treatment for ADHD, it's that three-prong approach, and you guys at the school are an essential part of that treatment program. Um, uh, one, we know that ADHD is really problematic in the school setting, so we have to think about all these different creative solutions. And then two, you're a place where you have so much knowledge about ADHD and behavior management, you can try things that you can also share with the families at home that could be things they replicate too. So school families are also looking for you for ideas of interventions. Um, Another key takeaway, we want to make sure that those interventions are using lots of positive feedback, positive attention, and rewards. And remember, we talked about how for kids with ADHD, those rewards, we want to think about a combination of praise as well as something more concrete and tangible like reward systems. And then whenever we're thinking about interventions for ADHD, we want to think about how do we make this really visual and concrete? And then also let's make sure we're including that positive relationship building as part of those intervention approaches too. So I want to thank you guys all for your attention and your engagement on this topic, and then I'm going to turn it back over to Haley.
Yeah, so we'd love to hear kind of we've heard what Lenny's key takeaways were, but we'd love to hear something that you guys may take away. So if you learned something new or a new tool that you'll try, like Lenny mentioned earlier, she had a lot of great book recommendations and other resources, so we will send those out afterwards. I know before we switch to the case, Lenny, we did also get a question in the chat from Jenna. Though I think we have a few minutes to cover. Just looking to see if you had any ideas on how to provide praise and positive reinforcements without being disruptive, particularly in a classroom setting when the expectation is to be quiet and focused.
Thanks, Haley, for bringing that back. I appreciate it. So I think some of the things we talked about with the para, I think you can do actually in a really quiet way. We talked about having kind of tracking of the specific behaviors we're looking for positive reinforcement on a tracking sheet on the child's desk, which for a young kid might be a combination of words and pictures of like a picture of a child raising their hand or a picture of a child sitting in their desk. And then the reinforcement might be as simple as coming over and quietly giving them a tap on the back and a thumbs up, and then giving them a tally mark on there. So that's a really quiet and hopefully unobtrusive way of giving that positive feedback. And then I also think all kids respond best to that praise if you have the ability to kind of buzz by their desk and quietly whisper it to them. All kids kind of like to get that praise on that personal level. Um, And then I also think it's okay to praise in front of the whole class. And it could be that multiple kids are getting praised for, great job, Johnny, for staying in your seat. Great job, Lisa, for staying in your seat. Great job, so and so, for staying in their seat. And one, that can make those kids who got that praise feel really good. And two, it might remind some of the other students of, like, oh, yeah, those are some things I should be working on as well. So I think you can kind of do a combination of those quiet whispered, those little thumbs up, tracking on a sheet, and then also intermingling occasionally with those more out loud praise as well.
Thank you, Lenny. That's super helpful. I think we can go on to the next slide. So just want to say thank you again to Lenny for always a wonderful presentation. And thank you again, Haley, for sharing your case with us today. I think it was a perfect fit. You all should have received a post survey in your inboxes. It's pretty brief. It should just take a few minutes. We'd really appreciate it if you could take the time to fill that out. They really help us to kind of tailor our future trainings for next year. And then as for just kind of wrapping up this series, we will send out the slides and resources in the follow-up email, and your certificates of attendance will be emailed once those are processed. So please just keep an eye out for those. And yeah, thank you all again for joining us for the Better Behavior Together Echo series, and we hope you have a great rest of your day.
Bye, guys. Thanks for joining.